this whole conference focuses on technology and the intersection of emerging technology with healthcare. Can you talk a little bit about how Stanford as a medical school and as a hospital embodies that theme?
I think the essence to our success is innovation. We are the epicenter of innovation, and we use innovation to lead the biomedical revolution. What we try to do is to bring the very best science, the very best knowledge to the benefit of each of our patients, and to do so in a way that's patient-centered, that engages the patient in decision-making about his or her health care, and also engages the family in discussion of medical decisions and also the implications of those decisions. And having the opportunity to bring that together in Stanford medicine with the talent we have here, with the relationship we have with the university, the relationships we have with industries in Silicon Valley, it's really a unique opportunity and a very bright future ahead of us.
You bring up a great point about patient empowerment. That's another theme that this conference has been exploring. Can you tell me a little more about how Stanford is also engaging in increasing the role of the patient in their own care?
It's done in a number of different ways. One is through care coordination, making sure that, particularly for complex medical conditions, really for any medical condition, but it comes up most prominently in complex conditions where there are multiple physicians involved, care that's spread out over days, months, years, care that really never ends in terms of surveillance after a disorder has been treated. It's important to make sure that care is coordinated in those situations, that patients always have a person to turn to, a person who knows their full history, who knows the full manifestations of their treatment, both past and present and future in terms of the care delivery plan. So it begins really with the care coordination. There's an important human element to that will always be present and that we want to provide in great detail and with great clarity. There are also technological innovations that can assist us as care providers in being able to do that. So we have apps that do everything from encouraging children to do their dental flossing, which for those of us with children can relate to what a challenge that is, to monitoring people's blood pressure and pulse with telemetry, to enabling them to interact with care providers remotely through telemedicine, to enabling physicians to examine patients through telemedicine that may be continents away. So we can leverage that technology here at Stanford and bring it to the benefit of patients and their families in ways that I think few others can.
Throughout this conference and the talks that I've been sitting in, I've just been thinking about how do we get the future generation of physicians to be more plugged in and aware of how to use social media?
Well, one way is to put to make information available in ways that are meaningful to patients. For example, in an interactive way, enabling people who have recently been diagnosed with cancer to find the evidence pertaining to various treatment modalities for the cancer they've been diagnosed, to create an interface that enables them to access the power of the medical information that is available, but in ways that are accessible to them. That sort of building that interactive platform. So in one sense, there is an enormous amount of data available through PubMed, through a variety of other more professionally directed websites and data repositories. There are some patients and their families who are fluent with accessing those, but many others won't be. So how do we build the interface that gives them the same power of that information, but puts it at their fingertips, thereby enabling them to participate intelligently and in an informed way about decision-making of their treatments and their preventions.
Right, and that's a very important goal to work towards, I think.
Absolutely.